What are the benefits of losing extra weight in diabetics? Hi, if you are new to my channel, I'm Dr. Joshi. I'm an endocrinologist. In this series on weight loss and diabetes, I will be talking about the benefits of losing extra weight. Around 60% of people with type 1 diabetes and around 85% of people with type 2 diabetes are carrying the extra weight or are living with obesity. Addressing weight concerns is a delicate matter for many individuals, and achieving an optimal healthy weight can be a challenging task. However, for those managing diabetes, shedding excess weight can offer significant advantages. Not only will you experience increased energy levels, but you'll also lower your risk of severe complications such as heart disease and stroke. Weight loss can positively impact diabetes management, and for those with type 2 diabetes, it may even lead to diabetes remission. Despite the numerous benefits, many individuals with diabetes struggle to kind of maintain a healthy weight. It's essential to recognize that you're not alone in facing this challenge and support is available. Seeking guidance from your healthcare team is a crucial initial step. The benefits of shedding extra weight extend beyond the physical improvements to encompass your emotional well being as well. Carrying excess weight, especially around the waist, can contribute to fat accumulation around the vital organs, leading to insulin resistance. Losing this weight can enhance the effectiveness of both naturally produced and injected insulin. So, as you embark on your weight loss journey and increase the physical activity, adjustments to your medications may be necessary, particularly if you're on insulin or the oral anti diabetic medications. Collaborating with your healthcare team to explore the dosage reductions or other modifications is essential. For some, the prospect of requiring fewer diabetes medications serves on its own as a powerful motivator for weight loss. While weight is not a factor in type 1 diabetes, shedding extra pounds can still reduce the risk of complications and potentially result in reduced insulin requirements. For those with type 2 diabetes, losing around 5% of the body weight yields tangible health benefits. If obesity is present, achieving a more significant weight loss, approximately 15 kilograms or 2 stones, promptly after diagnosis, increases the likelihood of diabetes remission. Dispelling the myth that slow weight loss is superior, rapid and safe weight reduction is encouraged for optimal outcomes. Now, many individuals report improvements in mood, increased energy levels, and better sleep quality as an additional positive outcome of their weight loss efforts. So, what is insulin resistance? Insulin resistance occurs when the cells in your body fail to appropriately respond to the insulin produced naturally or when it's administered through medications. This inefficiency in insulin utilization leads to elevated blood sugar levels. While commonly associated with type 2 or gestational diabetes, insulin resistance can manifest in individuals with type 1 diabetes or in relation to other forms of diabetes. It can also be present in those at risk of type 2 diabetes, regardless of age. Now, insulin resistance may be diagnosed either alongside diabetes or as a precursor to type 2 or gestational diabetes. So it's crucial to understand what is insulin sensitivity. Insulin sensitivity, often, as mentioned by healthcare professionals, is synonymous with insulin resistance. This phenomena actually indicates that your body requires more insulin because it is less responsive to its effects. So, for certain individuals, dealing with insulin resistance and using insulin, higher doses are needed to actually manage the same amount of carbohydrate intake. For instance, carbohydrate ratio of 1 unit to 10 gram carbs equals higher sensitivity. 1 unit to 5 gram carbs equals insulin resistant or lower sensitivity. So what are the causes of insulin resistance? Insulin resistance is more likely if excessive fat is stored in and around the liver and pancreas. While commonly associated with overweight or obesity, it can affect individuals of a healthy weight or with a normal BMI, which is the body mass index. The exact cause of insulin resistance varies among individuals and is not yet fully understood. Factors like hormonal changes during pregnancy or puberty, as well as the type and amount of exercise, can influence how the body produces, uses, or responds to insulin over time. So one might think, how can I know when I have insulin resistance, or what will be the symptoms of insulin resistance? For individuals with diabetes, increasing blood sugar levels or HbA1c, which is the blood marker, may indicate ineffective insulin function. Those at risk of type 2 or gestational diabetes should be vigilant for signs and symptoms, as they could signal or point towards insulin inefficiency. So, what could be the common indicators? These include excess fat around the liver and pancreas. It also includes elevated triglycerides or cholesterol, and living with overweight or obesity. So, one might think, is there any treatment for insulin resistance? So, in order to treat insulin resistance effectively, one of the foremost strategies is weight loss, particularly for those who are overweight or are suffering with obesity. This can be a beneficial approach to enhance insulin utilization in various types of diabetes. Additionally, increasing one's physical activity levels may contribute to improved insulin function. Some individuals with type 2 diabetes may achieve diabetes remission through adequate weight loss. Ongoing research trials, such as the Retune trial, suggest that individuals with lower body weights and type 2 diabetes may also achieve diabetes remission through weight loss. And for those managing diabetes with insulin, such as using exogenous insulin in the form of injections, it is known that with this treatment, insulin resistance can be present, and it does not necessarily mean resistance to a specific brand or type of insulin. However, higher doses of insulin could be required to cover the same amount of carbohydrate intake. To enhance the insulin effectiveness, healthcare professionals may recommend additional medications such as metformin, which is quite commonly used in type 2 diabetes. And this can be prescribed to reduce insulin resistance in both type 1 and type 2 diabetes. The weight loss strategies that we could use, managing diabetes with dietary choices is a well-known approach, but there is no singular diet exclusively designed for individuals with diabetes. Weight loss can be achieved through various methods, and no one size fits all diet exists. The key is to consume fewer calories than needed. Calories measured in units, which are called kilocalories, provide the energy present in food and drinks we consume. Our bodies utilize this energy for daily activities, from basic functions like breathing to more vigorous tasks such as exercise. Replacing the expended energy through eating helps in maintaining a healthy weight. Recommendations suggest that men require approximately 2,500 kilocalories daily for weight maintenance, while women need around 2,000 kilocalories daily. However, individual calorie needs vary based on factors such as body function, activity levels, and weight management goals. To aid weight loss, there are 7-day meal plans available, and which are nutritionally balanced and clinically approved. They count calories and carbohydrates and formulate options with a low carb diet plan or a Mediterranean diet plan, or a lower calorie diet plan like 1,200 or 1,500 calories a day. So different approaches, such as low calorie diets ranging from 800 to 1,200 kilocalories daily, and very low calorie diets such as less than 800 calories daily exist. However, these may involve specialized meal replacement products. So if considering such diets, especially if using medications like insulin, it is crucial to consult with a healthcare professional. While a low glycemic index (GI) diet aids in maintaining and managing your blood sugar levels, evidence supporting weight loss in individuals with diabetes is still limited. Other popular diets like intermittent fasting and the paleo diet lack sufficient evidence for their effectiveness in diabetes-related weight loss. Some individuals prefer commercial weight loss programs for added support, involving calorie-controlled eating plans or meal replacements. When considering such programs, it is essential to inquire about healthcare professional involvement, diabetes advice, and nutritional completeness. It also becomes imperative that there is adequate provision of support and education. Addressing the emotional aspect of weight loss is crucial, as feelings of guilt, emotional eating, and impatience with progress are common challenges. Regular exercise contributes to overall health and weight loss. So prior to starting any new physical activity, consultation with the diabetes team is necessary, particularly for those individuals who are taking insulin or certain diabetes medications. For individuals with significant weight loss goals, weight loss surgery or bariatric surgery could be considered. It not only aids in weight loss, but is increasingly recognized as a treatment for type 2 diabetes, positively impacting insulin sensitivity and blood sugar levels. Additionally, healthcare professionals may also prescribe certain medications like orlistat or GLP-1 analogs to assist with weight loss, but advice should be sought from a healthcare professional, and caution should be exercised when considering initiation on these medications.